Today we are going to look at the drugs which are used in the heart failure. So to start off with questions, the first question is, what are the intravenous vasodilators and what do they exactly do? What is the role of them? The second question is, what are the drugs? Drugs which is used for the rapid symptomatic relief. So what are the drugs used? The third question will be, what are the common drugs? The drugs, name some drugs which are used in the chronic heart failure. So in this video, we'll find out the answers to all our questions, and in the end, there is also some bonus questions. So first, we start off with the acute decompensated heart failure. The acute heart failure. So under this, we have the IV vasodilators. That is the intravenous vasodilators. So under this, there is something known as the nitroglycerin as well as the sodium nitroprusside. So what these two do is that it decreases the preload and the afterload. Then what we see is there is something known as the nesertide. Nesertide is nothing but there is a recombinant human BNP. So this category is done. Next we move on to the IV, that is intravenous positive inotropes. So in case of the intravenous positive inotropes, so under this intravenous positive inotropes, the classes we are going to see, the drugs are firstly the dopamine, then we also look at the dopamine, then the epinephrine, as well as the norepinephrine. So what does these drugs do? So there is the beta 1, there is beta 1 receptor mediated stimulation, that is stimulation, and this is nothing but of the cardiac output. So then we have another class of drugs that includes the inoximone as well as the milrinone. So these two, what it does is there is the PDE 3 and 4 inhibitors. Then we move on to another class. So now we are going to talk about the levocemendan as well as the pimobendan. So these two drugs, if you see, it includes what it does, it combines. It's a combined calcium sensitizer and also PDE3 inhibitor. Then we move on to the next class, that is drugs which are used in rapid symptom relief. So drugs in case of rapid symptom relief. So here we have there is the bumetanide. There is bumetanide. There is furosemide. There is also torsemide. So these drugs, what they do is they are loop diuretics, and they are used for the symptomatic treatment. They are used for the symptomatic treatment, and this is of the severe heart failure. and acute decompensation and acute decompensation. Then we also look at morphine. So what is this morphine? So morphine is nothing but it is an opioid and it is used to calm the patient. It is calm the patient and decreases the cardiac output. So it decreases the cardiac output consumption. So this decreases it. Then we move on to, so what we saw till now is nothing, the acute. Now we'll move on to the chronic. So we look at the chronic heart failure. So under the chronic heart failure, first we are looking at the ACE inhibitors. So ACE inhibitors, they are nothing but the first line therapy. Then what about the ARBs? The ARBs, they are used in case of intolerance. So if the patient is intolerant to the ACE inhibitors, then we use the ARBs. Then we are looking at the beta blockers. So beta blockers, they are again the first line therapy. Then what about the spironolactone? There is a spironolactone and the eflarinon. So the spironolactone and the eflarinon, they are nothing but the mineralocorticoid receptor. So the mineralocorticoid receptor, mineralocorticoid receptor antagonist, mineralocorticoid receptor antagonist, and what it does is the first line drugs for symptomatic heart relief. They are the first line drug for the symptomatic heart relief. Then we move on to the SGLT2 inhibitors. So looking at the SGLT2 inhibitors. So here they are nothing but they are used in the first line therapy. The first line therapy. And what it does, it reduces the mortality. It reduces the mortality and also the morbidity. Then we look at the sacubitril. The sacubitril or the valsartan. So sacubitril or the valsartan, they are nothing but they are the neprilysin inhibitors. They are neprilysin inhibitors or the ARB or ARNI. Then we are looking at the drug ivabradine. So what is the use of this ivabradine? So this ivabradine is nothing but an inhibitor. It is an inhibitor of the current in the sinoatrial node. Inhibitor of the current in the sinoatrial node. Now we will go on to answering our questions. So the first question we asked was to answer in case of the acute decompensation heart failure, what are the IV vasodilators? This was the first question. So here we saw the nitroglycerine. We saw the nitroglycerine, sodium nitroprusside as well. Nitroglycerine, sodium nitroprusside. Then, so firstly we are looking at these two, that sodium nitroglycerine and sodium nitroprusside. So what it does is it decreases the preload. It decreases the preload and the afterload. Next we move on to the nesertide. Nesertide. So what is the nesertide? It is nothing but the recombinant human BNP. Next, the question we asked was, what are the drugs which are used in case of rapid symptom relief. Rapid symptom relief. So now we are going to look at that answer. So it includes the bumetanide. It includes bumetanide. It also includes the furosemide and also the toracamide. Bumetanide, furosemide, and the toracamide. So what are these? They are nothing but the loop diuretics. They are the loop diuretics. And where it is used in case of for the symptomatic treatment of severe heart failure, as well as and the acute decompression. Then we also have morphine. So what is the role of morphine in case of the rapid relief? Is that it is a opioid that we know, and it is to calm the patient, and it decreases. What it decreases is the cardiac oxygen consumption. Cardiac oxygen consumption. The third question we asked is name few drugs which are used in the chronic heart failure. So this includes there is the AC inhibitors, and if it is not successful, you can use the ARBs. Then there's the beta blockers, and there are also the presence of the spironolactone. There is eflarinon. There is also the SGLT2 inhibitors. There is also the sacubitril valsartan. There is a sacubitril. Next, there is also the valsartan, which we discussed. Valsartan. Then there is also the ivabradine. So all these are the drugs in the chronic heart failure. Now we are going to look at some bonus questions. So you can answer these questions in the comments. So the bonus questions. So this bonus questions, the first question we would like to ask is name the IV positive ionotropes. That is the intravenous positive ionotropes. Give the examples as well as let us know the function of it. The second question is the drug ivabradine. So the drug ivabradine, what is the action of it? What is the use of it? The third question we want to ask is name all the first line therapy in case of chronic heart failure. So name the first line therapy in case of chronic heart failure. So you can answer these questions in the comments.